Welcome. In this video, we will discuss about the influenza and the bacterial infection. So there was a recent study conducted by the researchers which kind of highlighted their correlation. So in the present world where we are living and we have seen how a pandemic could create an havoc and could crumble down the global economies, it becomes very important that we actually pay cue to the pathogens and keep track on it. So under this particular situation, various studies are being conducted, and the recent study which was conducted highlighted their correlation. So in this video, we will discuss about the recent context. We will also go ahead and discuss about the influenza and pneumonia diseases and also the antimicrobial resistance. So let's start. So recently, researchers have come out with the finding on superinfections and have highlighted that influenza makes people more susceptible to bacterial infection. So this is the context because of which we are discussing about influenza and the viral and the bacterial infection today. Because a team of researchers have found that the people who are suffering from influenza become more susceptible for the bacterial infection, and they have coined it as a term called as a superinfection. Not coined it, it was already used, but they have classified it as a superinfection. So what does it mean? What is exactly a superinfection? So these are the infection occurring after, on or top of an earlier infection, especially following a treatment with broad spectrum antibiotics. So as a very what you can say side topic or still associated one is the antimicrobial resistance. You might have heard about it. WHO and even India have started various campaigns to make people aware that it is not good to take a cocktail of antibiotics. So you must have experiences like with yourself or even the people around you, that they go and get antibiotic. Either they do not complete the course entirely, or they will just take a cocktail of antibiotics, whatever is available at the chemist shop, like without any prescription. So because of such kind of treatment or self treatment, situation has become worsened. There is a kind of antimicrobial resistance. So antibiotics were a boon for the medicine. That drug was able to provide relief for the various spectrum of diseases which were very lethal in the previous ages. But what happened, because of the again the microbes will also want to survive the situation, so they have gone ahead and built a kind of resistance for these antimicrobial drugs, and now they have developed resistance to it, which means that we could actually go back decades in our advancement on medicine if the antimicrobial resistance is not treated properly. So superinfection is also considered one of the effect of the antimicrobial resistance, or one of the side effect you can cause because of the broad spectrum antibiotics which are taken. So what happened in the case of superinfection is that you are already infected by some virus or some bacteria, for an example. On top of it, the other virus or other bacteria or fungi attacks you. So it makes it super infection. Over the top of it, you were already suffering, and then you become more sick. It is an overgrowth of an opportunistic pathogen from the bacterial or yeast imbalance of systematic antibiotics. So this is what happened. Whoever the pathogen is, who is more opportunistic, who wants to survive and who is looking out for a host, if you are already infected with something, your immunity is anyway fighting for it. At the top of it, it becomes easier for them for you to attack. For an example, influenza is caused by the virus, but the most common cause of death in influenza patient is secondary pneumonia, which is caused by the bacteria. So you can understand from this perspective that influenza is actually caused by a virus, but the major implication or the major complication which comes out of influenza is when people die of secondary pneumonia, which is actually caused by a bacteria. So you can understand, like you were first attacked by a virus, and then on top of it bacteria also attacked. So this is also the recent finding, that if a person is affected with influenza or is suffering or is sick with influenza, then they become more susceptible for the bacterial infection. Now, why this kind of studies are important? Because this could actually help to develop the plans by the policymakers or by the doctors to prescribe in such a manner, so that they could create precautionary medications also, so that the person does not suffer the fate of being infected with the bacteria also. Now let's try to understand about the influenza. So this is one of the major disease which they discussed in their papers which were published. So let's discuss about the influenza. So it is a viral infection that attacks the respiratory system, which is your nose, throat and lungs, and is commonly called the flu. In fact, way back in February when the coronavirus was actually spreading across the globe, even the president of US at that time, the Donald Trump, he came ahead and said that it's just more of like host and it's like a common flu. So that was the kind of thing. So you need to understand first of all, influenza is a viral disease and generally we call it by the name of flu. What are the symptoms? Fever, chills, muscle aches, cough, congestion, runny nose, headaches and fatigue. So these are the major symptoms through which you can identify with the influenza. What are the some common treatment? So flu is primarily treated with rest and fluid intake, allow to body to fight the infection on its own. For an example, you are down with common cold, you are sick with common cold. Generally, you must have heard from the people around you or the elders around you to tell you that just take rest, drink a lot of water, and you will be able to cope up with it in like couple of days. And that is very true. If you really give time for your body, it has the capacity to fight back and like fight the pathogens. So this is one of the most common treatment for the flu. Then paracetamol may also help to cure the system, but non-steroid anti-inflammatory drugs, which is your NSAIDs, should be avoided. So this is something which is highlighted that the NSAIDs should be avoided by the medical association, but paracetamol is fine. An annual vaccine can help prevent in the flu and limits its complication. So again, viral infection could be treated with vaccination. Right now we know that for coronavirus vaccination development is going on at full pace. Even yesterday only I made a video about the coronavirus, like the mission COVID Suraksha, which is the India's plan to have a streamlined progress or the product cycle for the development of the vaccine in India. So such kind of things, but for normal flu, for influenza, vaccines already exist and one can get a shot of it every year to reduce the complication. Which are the vulnerable people who are like at high risk for causing of like catching the influenza? These are the young children, older adults, pregnant women and the people with chronic disease. So these are the groups which are specifically at high risk of catching influenza. Young children, older adults, pregnant women, people with chronic diseases and as well as people with depressed immune system. So these are the people who are most vulnerable. Similar thing in the present coronavirus condition also, we know that it is also one of the kind of infection which is attacking the respiratory system and these people are again very vulnerable to it. Now let's also try to understand about the pneumonia. So it is an infection that inflames the air sacs and in or both lungs, and air sacs may fill with lung or pus. So this is what happened in the case of pneumonia. The lungs, the air sacs get filled with pus or fluid and it makes it very difficult for the person to breathe in. Variety of organisms including bacteria, fungi and viruses could cause pneumonia. So this is something you need to know, that it is not only bacteria which causes pneumonia, but it is also caused by the virus as well as fungi. But the most common kind of pneumonia or the one which causes the maximum fatality or the morbidity is the pneumonia caused by the bacteria. What are the common symptoms associated with pneumonia? So it includes cough with phlegm or pus. So because the air sac is filled with pus, when you cough it could also come in that. Fever, chills, difficulty in breathing, like you feel really out of breath when you are suffering from pneumonia. Then what are the basic treatments? So it includes antibiotic can treat many forms of pneumonia. Some forms of pneumonia can be prevented by vaccine. So this is something you should know, that India under its universal immunization program also does have a pneumonia shot included in it, which is provided to its young children. So it could be prevented by vaccination. The infection can be life-threatening to anyone, but particularly infants, children and people over 65 are particularly vulnerable. So So this is something you need to know, that it can harm anybody or it could be life threatening to anybody, but high risk is infants, children and the people over the age of 65. So these are the few things you need to know about pneumonia. So with the present situation, like 2020 entirely has become a year which was marked by the COVID-19, you never know, UPSC might start taking more interest in the diseases and the pathogens. So it's good time that you have these information, basic information, whether these are bacterial, viruses, basic symptom, how they are spread, like whether human to human contact, they are contagious or not. All these kind of things will actually help you to score better in science and tech or in your GS section of your examination. So I hope you have understood this video. If you have any doubt, feel free to drop a comment. Thank you.